MUSC is one of multiple health organizations recently awarded a $17.5 million grant through the CDC. It's funding a new initiative to strengthen the state's infectious disease response. Claire Weber is looking into the layers of this project and actually what it means for the future here in South Carolina. Claire?
Tessa, this is a 7-year grant, but research has already started to get the initiative active as soon as possible. MUSC is teaming up with Clemson, University of South Carolina, and other organizations to bring the vision to life.
After the COVID-19 pandemic took the nation's public health system by surprise, MUSC is working to be better prepared for future outbreaks.
Not only do you have to know when something's coming, but you have to know exactly how bad it's going to be and how many patients are affected, how many healthcare personnel you're going to need.
The DMA Prime initiative can be broken into 3 key components: data, decision-making, and communication.
One thing we're doing from the very beginning is looking back in time a little bit to see what predicted outbreaks of COVID, RSV, and influenza in very different parts of the state.
Dr. Michael Sweat says this will help researchers better predict the trajectory of future outbreaks and identify high-risk areas across the state. The project will also produce decision support toolkits, providing guidance to health professionals on testing, treatment, and vaccination.
What kind of information did you get during the COVID outbreak, for example? Was it accessible to you? Did it make sense? What's the best way to present that?
As for the next step, Dr. Sweat says improving communication skills with professionals and the public is important in both regular flu outbreaks and an extreme like COVID.
We have experts on health communication that are working with these different groups to try to tailor those right now so that when these things happen, we are in a much better position than we were in the past.
And MUSC is eager to collaborate with other health experts across the state.
There's multiple different organizations with different skill sets. You're going to get, again, aligning in a single mission, you're going to get a better outcome.
This isn't just a short-term project. MUSC says it'll help build long-lasting resilience in the state's public health infrastructure. Claire Weber, News 4.